4.2 on the unconscious fraud. According to the unconscious fraud set of hypotheses, Xavier genuinely believed himself to be the mediator of deceased authors. There was no deception. Nonetheless, in the real world, no external agents dictated texts from the beyond. The medium's mind was responsible for elaborating his complete work without being aware of it. However, these hypotheses face the same challenges presented in the hypothesis of conscious fraud, except they do not imply dishonesty and possibly crime. This is because the medium's mind works in a way that he does not realize himself to be the true author of all the texts. Yet he had access to all the explicit and implicit contents of them. As we have seen, this would require lengthy and costly research work, access to many books, access to thousands of pieces of private information, and a considerable amount of free time. It would also require special skills to write original texts in different styles and types of text. The mental illness hypothesis is further refuted because Xavier never presented other symptoms of psychiatric disorders, such as loss of ability to perform daily activities, psychological suffering, social problems, and psychiatric comorbidities. Xavier was closely followed by the psychiatrist Dr. Elias Barbosa, who never found any sign of mental illness in the medium. In this sense, the latest versions of diagnostic manuals have changed to adapt to cases such as Xavier's, in which they now consider some sociocultural aspects that might influence the occurrence of dissociative experiences or hallucinations, yet still far from distinguishing non-pathological possession from mental disorder. For instance, diagnostic manuals do not acknowledge the interaction between the individual experience, which can be positive, and the stress caused by social stigma. Neither consider how a possession experience can develop when framed within a belief system. Research has shown that Brazilian mediums are socially adjusted, have a low prevalence of mental disorders or histories of physical or sexual childhood abuse, and do not use antipsychotics. This profile suggests that the mediumistic process can be characterized by dissociative and psychotic experiences not related to any psychiatric disorder. The challenging task of distinguishing non-pathological dissociative experiences from a mental disorder led some researchers to adopt the term anomalous experience, which does not assume psychopathological implications. Given this background, some authors have proposed a guideline to assess the clinical significance of spiritual, psychotic, or dissociative experiences, which considers the absence of psychological suffering, the lack of social and occupational impediments, the duration and frequency of the incidents, the capacity of the medium to perceive the unusual, anomalous character of such experiences, and the insight that they may not be shared among others, the absence of psychiatric comorbidities, the control over the experience, and finally, personal growth promoted by the experience over time. Thus, diagnosing mediums with a psychiatric disorder based on the presence of dissociative experiences does not suffice. Other possible explanations, posited based on abnormal levels of neurobiological molecules such as DMT, also lack foundation. Although the idea of having a center in the brain that could connect one to the mystical world sounds exciting. No abnormalities were ever found in the size of the pineal gland, nor in the levels of bufotenine or DMT among individuals with mediumistic experiences. Moreover, the pineal gland would need to rapidly produce a 600-fold increase of DMT to provoke a psychedelic experience, a heroic biochemical feat. These results suggest that spiritual experiences such as the ones reported by Xavier are most likely not produced by an abnormal pineal gland nor by an extravaganza of endogenous psychedelic substances. Likewise, the sociocultural hypothesis loosely fits the phenomena described here. inasmuch as Xavier allegedly started his communication with the deceased very early in life, around the age of 5, when he did not understand it. As described by the medium, such episodes would lead him to either punishment or bullying, embarrassment at the least. Although one could argue that his mediumship released him from suffering, the position achieved by Xavier did not provide him any status to tackle an existential issue. Instead, at the age of 17, it offered him relief from an understanding of his abilities. So, overall, the hypotheses postulated based on unconscious fraud are ruled out because they poorly explain the phenomena described in this essay.